Hello and a very warm welcome to the Hertfordshire and West Essex Training Hub. My name is Scott Downham and I am one of the lead clinical pharmacists within my locality and one of the 6 pharmacy ambassadors working across the east of England to help support the pharmacy infrastructure around training and education within primary care. So I just wanted to give an overview really of a couple of things that I thought would be helpful as a colleague, clinical pharmacist working within primary care to navigate your way through the system as you embark on your new career adventure. So I'll talk about what is expected of pharmacists to work in primary care, some useful tips, resources and any support that I feel would be helpful for you. So this slide is an overview of the typical workload that would be expected regardless of the PCN you're working within across the ICS. So we expect everyone to enrol as soon as possible on the mandatory CPP course. Now, as you will know, this is an 18-month training pathway. If you are coming into primary care with a wealth of experience, there is an exemption process, and the CPP are currently working on that exemption process to make the exemption as smooth as possible for you. And I would encourage you that if you're having any difficulties or problems with the exemption process, that you contact me and I'll provide my details at the end and I'll get back in touch with the CPP to help support and facilitate that. As part of that 18-month training programme, you'll undertake your independent prescribing if you haven't already done so. And the expectation at the end of that 18-month pathway is that you are working across all areas of medicines optimization to support the medication reviews in a structured process, also known as the new SMRs, but really seeing patients with complex comorbidities and a wealth of medicines to help support reducing the GP workload whilst maintaining that patient safety. You'll also be expected to work autonomously to some extent, although we recognise that you'll need ongoing support and supervision, whether that's from one of your local GPs or from your senior pharmacist. We also expect you to be able to interpret blood tests and reconcile medicines according to those blood tests. And then at the end of that, you might go off and do some different career pathways to support your training. So all of the training can be found on the Training Hub site around the particular modules that you can enrol for. And that might be a minor illness course, a top to toe course, or at the end of the 18-month training pathway, we're working very closely with Health Education England currently around what this will look like, and the 2 avenues that you may go down will be the advanced practice route recognised by the Royal Pharmaceutical Society or the advanced practice courses recognised by Health Education England. You are expected to be able to do chronic disease management at the end of those 18 months of training with the CPPE. As I said, work to an extent autonomously by reviewing and adjusting patients' medications, and also providing your specialist expertise in the world of medicines, as well as cost-effective prescribing to support the wider NHS workforce across the ICSs with reducing costs to our prescribing and making sure that we're adhering and following to the guidelines where applicable. You'll also be expected to provide some leadership to an extent on person-centred medicines optimization and quality improvement, whether that's through a service evaluation or ongoing clinical audit. So some useful tips when you first join primary care. The most important thing that you need to do is develop your relationships and networks. At the practice level, you must make sure that you get contact and maintain contact with the practice manager. Some surgeries will have an operations manager as well as reception managers too. With regards to your peers, make sure from day one you know who the PCN pharmacists are that you're working with, and also importantly the senior pharmacist who's there to support you and to some extent give you your supervision. Within the PCN, make sure you know who the clinical director is, because a lot of the work that we're expected to do from a contractual obligation point of view will be directed by the clinical directors. And then within the ICS, we're coming together to work more strategically with all of the pharmacy medicines optimization teams and the in-practice pharmaceutical advisors. There's also a pharmacy tutor who's working at the pharmacy hub, who will always try their utmost when you join primary care to help that induction process. So make sure that you let us know who you are so we can add you to our mailing list, and just make sure that you explore the hub website. The IT systems are really important, and there's two main IT systems that primary care use. Make sure that you've enrolled on the training or somebody's helped you to enroll on that training from day one, and ensure that the smart card that you have is registered as soon as possible. We've spoken about the training pathway already, but just make sure that you enroll as soon as possible, because those first 6 months of being in primary care are the most important in terms of the training pathway, helping you navigate your way through all of the different aspects of primary care. Explore the diversity and work with your colleagues. The expectations, as we said, at the end of the 18-month training pathway are to be seeing as many patients as possible with chronic disease management. Make sure you work hard and embrace the role, and obviously your career development is important, hence why we're here to support with that. So the resources that you will come across which will be helpful to your everyday practice: the first 18 months, obviously the primary care PEP pathway, the Herts and West Essex Training Hub, and I've provided the website on bullet point number 2. And again, importantly, supervision and clinical support, whether that's through the PCN pharmacist or the GP lead, or some localities also have AHP GP leads to help with that as well. The PMOT team will help with governance and cost-effective prescribing through the ICS, and also the 3CCG guidelines, which over time hopefully will come together to form one, but at the moment they are our 3 separate websites, and there's also some helpful antimicrobial apps that you can download to your mobile phone. The Royal Pharmaceutical Society framework will be important after the first 18 months of training to decide whether you go down an advanced practice route, an advanced pharmacist practice route, into perhaps even a consultant pharmacist as the years go on, or working with Health Education England on the advanced pharmacist practice course, and the website is provided there. Obviously, if you want any help or support or further information regarding any of this, then please contact me and I'll put you in touch with the appropriate people. Other resources that are easily accessible that you'll need through your career are listed in bullet point number 7, and that includes the Specialist Pharmacy Services website. You'll also need your specialist websites, whether that's, for example, the NUT guidelines. We also have medicines information, and that your local medicines information department can be found via the SPS website. And also, as time goes on and you become more confident around reviewing more complex patients, we also have Consultant Connect, which can be downloaded on your phone, and you can contact a consultant regarding specific clinical questions. So the support that's available, obviously we've spoken about the supervision and the pathway. Us here at the Herts and West Essex Training Hub, there's also a how-to guide which will help you settle in as a clinical pharmacist over those first 18 months with more of tables and tick boxes to make sure that you are not missing anything going through your training. The pharmacist tutor who we have is known as Lean Cover. She's currently on maternity leave, and Holly Ryder will be covering up until late next year of 2023. And then, as I said, my name is Scott Downham. I am the pharmacy ambassador. My email address is bullet point number 5. If you require any help or support, particularly from an educational point of view, please do get in contact with me, and I'll do my best to help you. Thanks very much.